We'll be needing a long marking torch if the bed is not protected already, a bottom sheet, a drawer marking torch and a drawer sheet, 2 pillow slip for a foundation bed, a top sheet and a counter pin. So the first thing you do is you turn the mattress and straighten out the creases. Then you cover the bed with a long marking torch if the bed is not protected already, but you can see that our bed is already protected with its own cover. So the next thing is to take the bottom sheet, spread it on the bed. You really have to straighten it. We will put the smooth parts at the upper side and the rough part below. So the smooth side will touch the patient's body. 2 nurses will work in harmony to do this bed making procedure. So you have to raise the bed and tuck in that side. At this side, you raise the linen in a right angle, then you place it on top the bed, fold the remaining side, then you bring down the part that you've taken up, as you can see, then you also tuck in it. What we are trying to do in this place is an envelope corner, and an envelope corner is also called a mitter's corner. This will help the bed not to pull off when patient is on top. It will help to secure the bed. So the material we are using is a very slicky one that will pull off. That's why my assistant has to hold that part. So we are trying to secure the bed. After doing it at the head of the bed, we'll go down to the bottom of the bed and just do the same thing. As you can see, we are doing the same thing. Then after doing it, we tuck the sides of the bed all round. We just tuck in everything. Bed making is a 2 nurses procedure, and 1 nurse will supply all the equipment needed for the bed making. As you can see, we are done tucking it in and it looks smooth. All sides are tucking in. You need to make your work clean and you need to make it very well to prevent irritation on patient's body. We assume that you are learning this for the first time. That's why we are slow. But in the case of an OSCE, you have to do it very fast because you'll be given a limited time. So this we are trying to put is the drawer marking torch, and you just lay it on the bed. No flapping of clothes. Do not flap to prevent nosocomial infection, which is the infection gotten from the hospital. So my assistant is tucking in her own parts. Then I will also do the same thing at the other side. The marking torch should not be too close to the head of the bed and too close to the bottom of the bed. It should just be at the middle. And this next thing we are putting is the drawer sheet. The drawer sheet, what we are going to do, if you look closely, you see that I gave my assistant more parts. Then I am tucking in my own part at this other side. Then my assistant is going to take the excess and lay it on the bed, then tucking this other side. Then if she's done tucking this side she is tucking right now, she will also take the excess and tucking it. Why we are taking in excess is because of if a patient soil one part, rather than removing everything, we can just bring out more excess and shift the part that is already soiled. So these are the additional requirements for a cardiac bed. We have sandbag, that's what I raised up. We have an air ring. We do not have an air ring, but we'll be improvising with that. Then we have a top sheet, and we also have a counter pin. Yes. We also have 4 pillows here, but the pillow they use is 6 pillows. So if you have 6 pillows, make sure you use 6 pillows. But here I have 4 pillow, and this I'm raising is a bed cradle. You see what we are going to be using it for. So now we are going to elevate the bed with the bed elevator that is there. We are supposed to use a backrest, but because we do not have a backrest, that is why we are elevating the bed. So we will, after elevating the bed, you also try to arrange the sides that are scattered due to the elevation of the bed. Then you also try to arrange your pillow. Remember I said it is 6 pillow for a cardiac bed, but because we have 4 pillows, we are using 4 pillows. We don't really want to go astray, but remember I said it is 6 pillow. You arrange it in an armchair. There are other necessary requirements used in cardiac bed, which I will mention at the end of this video, but I hope you are learning what we are doing. I hope it's understandable and easy. So what I'm trying to do, I'm trying to use this linen to make an air ring. I'm trying to improvise because we do not have an air ring, and it is necessary for a cardiac bed in order to prevent pressure sore, because this patient is coming with a cardiac problem, and because of the cardiac bed, we do not want the patient to develop any kind of complication. So that's why we are putting this air ring. Guys, please make sure to subscribe to the channel if you haven't. That's the only way you can appreciate me right now. So the next thing we are going to place over the bed is our bed cradle. We will place the cradle over the lower limb. You know your lower limb, that's your leg. That's where we will place it. And it will help to raise the linen, because patient is already having complications with breathing. We don't want to put something heavy that will make the patient not to breathe well. Then we also put our sand bag. That's what is in that green thing that you're seeing, the sandbag, which will help the patient to stay well on the bed and not to shift from bed or fall out from bed. So this yellow color linen is our top sheet. We will just lay the top sheet on top of the bed. Then we are also putting our counter pin. So after putting the counter pin, we would tuck in the counter pin, then we tuck out the top sheet to be on top of the counter pin. And I'm also going to open the counter pin and the top sheet at one side so that it can serve as an entry for patients. We will also need to place a table. If the bed has a table, we'll place it over. If the bed doesn't have a table, the locker close to patient, we will place a pillow there, so that if patient wants to lie front, the patient can also lie front. We'll also place a sputum cup and a bell to call the nurse's attention, and a sputum cup in order to spit in. An oxygen cylinder will be there in case of an emergency. Then we will also keep bed locker closer in order to avoid straining. We will also keep a suctioning machine at the side of the bed if need be. So guys, if this video was understandable and you learned something, the only way you can appreciate Anwulika Joy is by subscribing to this YouTube channel, Anwulika Joy's YouTube channel. More procedure videos coming your way.